but something has brought us together. So, Michael, clearly you're in a care hospital environment at the moment, are you?
I'm in a long-term care hospital in Ontario, yes. And it's the only place left for me. Medically, I was finally diagnosed with an idiopathic neurological disorder. And I've kind of been ghost-lit. The word vaccine injury is not being mentioned in any of my medical reports.
Idiopathic, of course, is just a long medical word that means I don't know what caused it. But we have got very strong suspicions and associations of what causes it. I mean, typically, if it is that you have got this condition called transverse myelitis, we would expect to see, I don't know, 1, 2, 3, 4, 5 million cases per year. But we're seeing a lot more. But before we go into that, Michael, I mean, you were a pretty fit bloke, weren't you? Did you walk across Canada or something absurd like that?
I did. 20 years ago, I walked across Canada. And I was still very active, doing my gardening, riding my bike, and keeping active in my mid-50s, yeah.
So you were pretty fit, and then take us back to the start of the pandemic. Take us back to 2020. What happened then?
Well, I got COVID once, very mild case, diarrhea, throwing up, and then the vaccine rollout came, and I got my first vaccine. Mild effect, not much. It was a AstraZeneca.
So you got COVID in 2020?
2021, I believe.
2021, and then you had the vaccine in 2021 as well?
Yes.
Yeah, and that was the AZ?
Yes. And then I had a Pfizer later that year. And then in 2022, I had my first Moderna vaccine. And in January, and then October that year, I had my second Moderna vaccine. And that was the one that really kicked it off. It was within 36 hours of having that vaccine that my legs started to drag. And I had the TM kind of moment. I didn't know what to think of it. I went to my doctor, and my doctor immediately said, "Don't take another vaccine." And the doctor was very explicit that this was probably the result of a COVID vaccine injury, although they were not willing to write that in the report.
So they were willing to tell you that, but no one really wanted to write that down?
No, I mean, they've been told by their College of Physicians here in Ontario that if you write someone down as a vaccine injury, you will be reprimanded and can you lose your license.
Yeah. Absolutely ridiculous situation. Anyway, take us back to the times you had COVID once or twice, Michael?
Twice.
Right.
Yeah.
And how were you with that? Were you particularly ill or?
Not really bad at all. The first time, like I said, diarrhea and throwing up. The second time I had a bit of a fever, and I only really found out because I did a rapid test. And it was, that was in June of 2023 or 2022. Or 2023, 3 months before my final vaccine. And you know what? I ended up watching one of your podcasts that mentioned about transverse myelitis and talked about the idea that like antibodies, COVID antibodies in my blood system, when I got my final vaccine, that most likely it's what activated my T cells and B cells, is these latent antibodies. And, from that's what activated this whole chain of events where, these T cells and B cells are attacking my body to the point where I had 2 lesions on my spine. One that covered my C1 and C2, that was 2.8 centimeters, which is rather large. And another one on my T4 that was 0.4 centimeters, so it was a bit smaller.
I mean, C1, we're talking about right at the very top of your neck there, aren't we? So
yeah,
I want to talk about the history of that and the way that's presenting in a minute, but let's go back to the first 3 vaccines. As far as you remember, you were okay with those?
Yeah, no problem.
And then after the fourth vaccine, which the second Moderna, did you feel anything straight away? Or was this effect delayed by several hours?
It was probably delayed by about 32, 33 hours.
Right, you didn't feel anything straight away?
Yeah, nothing straight away though, no.
Yeah. So what, a day and a half later, what happened? What was the first thing that you noticed?
Well, I was walking home from an event in my hometown, and my leg literally started to drag. I couldn't lift it up, and it was really bad. I had my son had to help me home, and walk home. And when I got there, I laid down. The next day I woke up and it had receded a bit, but I could feel the effects. And anytime I exerted myself, the effects came back.
And did you have any other, apart from this localized sort of foot dragging, did you have any other symptoms? Were you feeling ill?
No, just fatigue, and the next week it was followed. I was still working at that point. I was still driving school bus. And it was the following week, about 5-6 days later, driving home from my morning school bus run, that I blacked out. And I finally pulled the bus over and stopped. And my eyes were fluttering, almost like it was an earthquake. And my ears were buzzing in such an extremely weird and unusual way.
So these were symptoms you'd never experienced before, the eyes flickering, the ears buzzing, and the blackout.
Yeah, I literally blacked out driving a school bus.
Heck, were the kids in the bus at the time?
I had already finished my run, and I was on my way home, thank God.
Wow. That's just doesn't bear thinking about, does it?
No.
Were you injured in that accident?
No. I managed to pull the bus over. I kind of went off the road and had two wheels on the apron of the road, and ended up getting it under control and stopped.
Well done. And what did the doctors think when you sought medical advice after that?
Well, in 3 hours, I went and saw my doctor. And my doctor, she said, don't take another vaccine. I had my license pulled voluntarily because of this, and we were trying to find someone to get an MRI for me.
Mm-hmm. And we have actually seen the MRI because Dean actually made a film of this, partly of your story, which we're going to talk about with a separate interview. Why can't we talk about this? And you can actually see the lesions on your spinal cord. So there's no question about the diagnosis there. We can actually see it. It's
Yeah, I mean, my neurologist here in Hamilton, Ontario, he basically said, I've never seen a lesion this big on someone's spine that wasn't the result of an actual impact accident. And he basically said, in this region, when you have lesions up in C1 and C2, that's God's country, and there's not much we can do. We can't operate, we can't really do anything in that area at all.
It really is. So in the days after that, so this incident when you were driving was what, 5 days after the fourth vaccine?
Approximately, yeah.
And then how did things unfold after that?
Well, my health started to decline. The more I exerted myself, the more my body started to go into post-exertional malaise, swelling in my legs, swelling in my neck, spasms. I even started at that point having clonus, where my legs would shake uncontrollably. Yeah, jerky stuff. And, I did finally get to see my neurologist rather quickly, within 3 months of when I first had the incident. and they did a large course of corticosteroids, which is standard for transverse myelitis. And it really helped. Like, from not being able to get up and barely being able to walk, I took the steroids, and it was 5 days of 250 milligrams of corticosteroids. And I was like an Olympic athlete, like up picking strawberries and running around. But it only really lasted for about 5 or 6 days after that.
This is what neurologists do. They give large doses of steroids, and it takes away the inflammation, and that improves the symptoms.
Yes, yeah.
But it's not treating. Typically, it's not treating the fundamental underlying cause.
Yes.
So you put weight on with the steroids, no doubt.
I did put a bit of weight on, yeah. But then I changed my diet. I went on to like an MS style diet, where I cut out sugars, dairy, all the things that you would typically do, and went on to eating just fruits and vegetables, trying to take down any inflammatory food. And that really helped as well, But once again, it only helped a bit. And my health continued to decline. At this point, I was walking with a walker still, and I could get around. And there were moments where I could actually get up and walk without the walker. But the continual decline of my ability to walk continued over the next year to the point where I couldn't walk anymore. And it continues to decline, where right now my hands, you can see my hands here, I can't really open them. And if I went to close them a few times, like, I can't even open them right now. I'd have to wait and stretch them open, and it's going up my body, this neurological thing. And the prognosis is that if it continues, it'll eventually, the axons in my spine, because of the demyelinization, will eventually start shutting down my vital organs.
Well, I mean, the lesions are very high in your spinal cord. This is the problem, isn't it? It's starting to affect your hands as well now. So feet first, and then kind of went up your legs, and now it's affecting your hands as well.
Correct.
Yeah. And presumably it's affecting bowel and bladder function, Michael, is it?
To an extent. I mean, I can't go to the washroom anymore normally. I physically can't get up and go to the bathroom anymore. And, but I'm still able to pee and poo like normal. I mean, it's just, unfortunately, I have to do it in a diaper now.
Yeah, sure. So you've been diagnosed with acute atypical transverse myelitis, which is, it's just a descriptive term, really, isn't it? Acute means it came on all of a sudden. Atypical means haven't seen that many times before, mate.
My neurologist says he's never seen this before.
Yeah. And transverse myelitis, of course, goes across the spinal cord. So the impulse is going up and down. So do you have that loss of sensation as well as the motor?
I can feel everything. I can feel my toes. I can feel the sensation in the skin. It's funny. I had a dream last night where I was walking and I could feel the muscles in my legs pumping as I was walking. And I was like, wow, I can walk. And then I wake up and I can't even move my legs. It was very frustrating.
Yeah, but it's strange that the sensory nerves don't seem to be affected. Do you get pain? Do you get tingling?
I do get some tingling, but I can feel everything. Like, I mean, I have all the the sensations of touch in every part of my body.
And you haven't got any phantom pains?
No. I have clonus. I do have spasms that happen regularly, daily, usually 3 or 4 hours of spasms every morning. It's not pretty. It's my life, and it's something I'm dealing with on a daily basis.
The spasm's painful. It's like a cramp, is it?
Yeah, it's kind of like a cramp. It's, sometimes my legs start kicking uncontrollably. Sometimes it's my arms. They stretch up and they start spasming. It's very painful in the shoulders. So it's and it used to be all exclusively in the legs, but as this has progressed, it's now more in the shoulders than it is in the legs.
Did the MRI show any lesions in your brain as well, Michael, or just in the spinal cord?
None at all.
Because I would be hopeful that if the lesions are restricted to the spinal cord, I mean, the control of like your cardiac centers and your respiratory centers are all in the brain itself.
Yeah, and the thing is, it's not the oligodendrocytes and the myelin produced by them. It's more the myelin produced by the Schwann cells that I'm trying to really get reinjuvenated.
So basically, it's a bit like a multiple sclerosis type condition, that you've got central nervous system myelin loss, central nervous system demyelination. Are your peripheral nerves okay as far as you know? Have you had those tested?
I haven't had them tested. Like right now, because of my diagnosis being idiopathic and what has happened, I'm not seeing any doctors really. I'm basically been left here at a long-term care home with minimal supervision. I see my doctor maybe once a month who comes around sometimes. I've just been left here because the Ontario health system doesn't know what to do with me.
Yes. I guess we don't like patients that are inconvenient and difficult to diagnose. We like patients that will slot into a neat sort of diagnostic category.
It's part of the problem with Canadian health. If you have cancer, if you have Crohn's, if you have any known disease that have core competencies that can be followed, Ontario and Canada is a great place. They'll give you the treatment. But if you have a condition which is idiopathic, which is undefined, they don't know how to deal with you. And, eventually they just shuffle you off to a corner because they don't have the resources. I asked to have plasma apheresis. I asked to have hyperbaric chamber, but it was said that because my condition does not qualify for these, because my condition is idiopathic, it doesn't qualify for the allocation of these resources.
Absolutely outrageous failure to treat you as an individual.
Yeah. But that's the way it is, unfortunately, because I don't fit into their box. I don't have a disease that plasma apheresis is given to in Ontario. I don't have a condition where hyperbaric chamber can be made available. And that's the problem with me, is I don't have a disease they recognize.
So what medical treatment are you receiving at the moment, if any?
I have baclofen. They give me baclofen for the spasms.
So baclofen's just a thing that will reduce muscle spasms. That's
Yeah, that's about it. I'm on a bunch of supplements that I'm paying for, a lot of the COVID protocols to help reduce the spike protein. Ivermectin, NAC, nanokinates, turmeric. You can go down that list that everyone's seen. I do get once a week 10 milligrams of immunoglobulin. Thankfully, I had a doctor here in Hamilton, immunologist, who's like, let's give it to you. And he kind of went outside of what he should have done, and he just gave it to me. And I'm now getting that, but it's only minor, it's not what I need. It helps a bit, but I need so much more.
Yeah. And you also need more diagnostic procedures. I mean, if there's a disease that's not recognizable, you would expect research doctors to be coming around to see you and Has anyone asked you to take part in any research project, or is this something that you want to?
You said research project in Ontario doctors? That's funny. I mean, unfortunately, all the research is clinical research. It's lab research. It's in the test tube. It's not in the body. And it's unfortunate that, I've reached out to different clinics, to different specialists, and all of them have basically refused to see me.
It's unbelievable. I mean, why would you receive? I mean, you would think, the risk of being insulting, you were an interesting case.
You would think so, yeah. And unfortunately, the only doctors who are willing to see me are doctors in the United States, and I really can't afford, $250,000 to cross the border to go get health coverage in the United States. It's just I don't have the money, and it's sad that there is treatment out there, and I can't get it.
Yeah, immensely frustrating and anger-inducing, I would imagine. It's.
I've learned to let go of the anger, John. Anger doesn't serve me. It's.
You're right, but it's also really quite difficult. Do you know if you're still producing spike protein? Have those tests been done?
No, they're not available in Ontario. There are, you can look at antibody tests, and I think they've just become available in Ontario, I found out the other day, and I'm going to look into them. But there are no spike protein tests available in Canada.
Because if your antibodies for spike protein were still very high, as people with vaccine injury report sometimes, that would indicate you've got ongoing production of spike protein, and they can also tell if there's a type of antibody called immunoglobulin type M.
Yes.
If it's recently produced, so that would be interesting to do. In Germany, of course, they are doing spike protein tests,
and in Italy, I believe, as well.
So, what's the typical day like for you at the moment, Michael?
Well, I spend about 23 hours in bed. I'm lucky that I do still have my phone, and I can interact with that sometimes when my hands are working. I reach out. I share the message of hope, and basically I'm bedbound, John. Don't get me wrong, it's not easy, from someone who spent most of his time outside enjoying life. But I try my best to look at the positives.
How do you feel the sort of trajectory is at the moment? Are you sort of level? Are you slowly getting worse? Are you slowly getting better?
I'm slowly getting worse. I have been on a 2.5-year descent from where I could, walk with a limp when it first started. Then I could walk with some poles and canes. Then I could walk with a walker. Then I couldn't walk without help. Then I was wheelchair bound. Then I became bed bound. Then my hands started to go. And, I followed the trajectory. John, if it continues, I'll be lucky to make Christmas. I'm hoping that I can find a level to sit at. I'm hoping that I can find a plateau to sit on, but it's tough when, I don't have the resources available to even get an electric wheelchair right now. I don't have, I'm looking at all kinds of treatments I'd love to get privately, but I can't afford them, and it's rather sad, but it's the reality of my life. And, I'm very lucky in my life to have been blessed with seeing the country and meeting amazing people. And I've always found that in being in service to others, it allows me to have a purpose. And if nothing else, if me going through this disease and me talking about what's happening to me, it can help other people who are dealing with this as well, then I'm doing something. And that makes all the difference to me, John. You know?
It's a noble thing to talk about your suffering.
You know what? It's the only thing I have left to talk about, John. I can't play guitar anymore. You know, I can't hold my grandchildren. I can't even masturbate anymore, John. You know, there's not much left. So what can I do for others? And, you know, it's, we all have to die sometime. But you know what? Not all of us get the chance to really live. And that's what I'm trying to do, is live.
I have talked to quite a few people around the world who've had various sort of neurological presentations after the vaccine. It seems to be unpredictable. Some people get sensory features. Brianna Dressinger, you maybe saw her video. She said it feels like she's rolling in cactus all the time, affecting her sensory nerves. Other people like you, it seems to affect the motor systems.
Well, at one point, John, I did have that feeling. I had migraines and spasms. But when I changed my diet and went to an anti-inflammatory diet, that got rid of a lot of those problems, you know, and that helped a lot. You know, I also do 2 hours of breathing every morning. I do Wim Hof breathing. I do nitric oxide breathing where I hum. I do that for half an hour, and then I do deep breathing. And those little things allow me a little bit more energy to do the things I can in a day.
Mm-hmm.